Does adjunct naltrexone or metformin deter weight gain with second-generation antipsychotics? Metformin, if you start it with olanzapine, you actually reduce the amount of weight gain that is experienced with olanzapine. If you begin to use it after they've gained weight, not so much. Metformin is not the easiest drug for a person to tolerate, but it certainly is cheap enough and worthwhile to consider. Naltrexone, no, did not really work all that great when tested. Any strategies for getting insurance, Medicaid, to approve metformin for antipsychotic weight gain? Metformin actually costs very little. Maybe we can talk afterwards in terms of improving access. I'd like to know exactly where you practice and what obstacles you've encountered. I saw increased prolactin has a risk of breast cancer. Would that mean I shouldn't choose it for a patient with a family history of breast cancer? Well, interesting. So elevation prolactin is not physiological. You don't want that. And so this is something that you might want to consider thinking about, but it's not an absolute contraindication. But I encourage you to have further discussion with your patient. Make sure that they know that, some degree of caution is required here. There's some data out there, but it's not absolutely definitive. But, having an elevation prolactin is not physiologic. Given the increasing ubiquity of smoked cannabis, are polycyclic aromatic hydrocarbons of concern for pot smokers who are also taking antipsychotic meds? I think so. I think so. But none of my patients smoke cannabis, so I don't really know. Okay. Is there a study that compares metabolic disease and progression in patients with schizophrenia who are on antipsychotics and metformin and those who are just on antipsychotics? Interesting question. I'm not sure how hard this data is. I think there may be some registry study somewhere in Scandinavia that starts to address this, but I'm not familiar with that literature to the extent that I can answer this question. When should I use quetiapine ER versus IR? Are they dose equivalent? Yes, they are. I think ER would probably be a better idea.